here today to really find out more about what we can do on the center itself. Now, before I start, I just want to share with you my lineage. Many people actually ask me, where do I get all my health knowledge from? Basically, my lineage when it comes to health is on the alternative, naturopathic, that means everything go by the natural way, all the way traced up to Dr. Bernard Jensen. So if you go for Google, you search for Dr. Bernard Jensen, basically he has all the information, and he's the father of holistic health. And then recently I found there's another doctor called Dr. Berg. I know some of you have heard of him before, about ketosis, about intermittent fasting. Dr. Berg is another one that's very good. So a lot of the knowledge is actually aligned with what Dr. Bernard Jensen is saying in that sense. Alright, now curious, how many of you here is the first time? That means you are here for the first time. 1, 2. Today we're going to have something very interesting, which is exactly how much does it cost you to be sick, okay? Without further ado, let's start. Come. I want you to focus on the screen. A lot of the times when we keep telling people, don't be sick, because the cost of it is very heavy. If you take a closer look, today's topic will be, we will start off with, what is the cost of being sick, alright? Now let's take a closer look. When it comes to sickness, the ultimate condition is actually cancer. That means at the end of the day, you will end up with cancer, alright? Or a stroke, or heart attack, okay? Now with this specific cancer, let's take a closer look. What is the top 5 cancers in Asia? You will see for the top part, you will see the lip oral cavity cancer, lung cancer, colorectal cancer, liver cancer, and stomach cancer. And top female cases, take a closer look. It's actually breast cancer, cervix uterine cancer, and ovary cancer, lung cancer, colorectal cancer, and other cancers. Right? So the top 5 are all there. Now, if you zoom in specifically, this is based on the statistic summary from 2018. Basically, on the left-hand side, you will see male. Male cancer, take a closer look. A lot of them are oral cancer, cavity. Second one, lung cancer. So for those who are smoking, please beware. Alright? Next one, or you live with someone that is smoking. Yeah, correct. A lot of times, people who doesn't smoke get cancer, not because they smoke, but because their friends smoke. Because they breathe in the second hand. Alright? Next one is colorectal, means your colon, that you are having cancer. The third one is, the fourth one is liver cancer and stomach cancer. Basically, stomach and colorectal are linked. They are all part of the digestive system. Alright? Then for female, take a closer look, female, you will see breast cancer, cervix uterine cancer, and then you will see ovary cancer, and you will see lung cancer and colorectal. Take a closer look for male and female. Basically, all have high risk. Out of the top 5 cancer, you will both get colorectal. Alright? So this is something that's very alarming because colorectal directly and indirectly derived from the way we eat. It's our eating habits. Okay? Now next one, I'm going to show you. Basically in Singapore, what is the medical and hospitalization cost for cancer patients in Singapore? Right? I believe not many people would actually do the research like this. How many of you actually did the research on how much does it cost you when you have hospitalization? Anyone? Nobody, right? That's right. Oh, can't be bothered, right? Now let me show you. How much does the treatment cost for cancer? Let's take a look. Average cost for cancer treatment runs in the $150,000 range. Okay? Now, let me show you. Basically, we did a different search, alright, and found out the estimated treatment cost for later stage cancer can easily range from $100,000 to $200,000 yearly. That's about $8,400 to $16,700 per month. So in short, if you have cancer and you are not working, you better make sure you have a passive income that's able to generate $8,400 to $16,000 per month to be able to sustain. Alright? That's the reason why a lot of them are actually buying insurance. By insurance, sooner or later you will finish. Correct? You take the calculation of 300,000 divided by 8,000, then you see how much it will last. So you better make sure you die before your money runs out. Understand? Clear? Clear what I'm saying? Okay, good. Come on, join. It's okay, good. Right, next one. Okay. How much does it cost for cancer treatment in Singapore? Let's say how much does it cost for radiation therapy? Alright? The cost of radiation therapy It's estimated from medical care reimbursement. The median cost for the entire radiation therapy range between 8,006 to 7,003 to 10,300 for breast cancer, 9,000 for lung cancer, 18,000 for prostate cancer. Okay, so please take note for men, prostate cancer is one of the top. Next one. Now, after spending all this money, what are the cancer survival rates in Singapore? Alright, for women, uterus cancer is as high as 92.3%, which is very good. Take a closer look. However, when it comes to liver cancer and lung cancer across other countries, we are less than 25% survival rate. That means after you pay all the money, you spend all the money, you still going to die. The survival rate is only 25%. Clear, yeah? Alright? So do not play with your own health condition. Start young, maintain young. Keep the engine going, just like motorbike. If you don't maintain the motorbike, after wear and tear, it's going to go haywire, or a car in a sense. Okay? Next one. Basically, should an 80 years old have chemo? Now, this is a question, very hot topic, because there are a lot of people that is older age where because of medical situation and medical cause, some of them actually ask 80 years old, time to go, no need to go do the treatment. Now, is that true? True or not true? Yes or no? Okay, how many of you feel that if your older folks in the family have cancer and they are 80 years old and you think no need to do, can I have a show of it? One? Okay, one, 80 years old, two. 80 years old, no need to do. Save the money. Okay, how many of you feel that 80 years old still should do? 1, 2, 3. Okay, 4. Then the rest, don't know, not sure. Not sure whether to do or not to do. David, what happened? If let's say somebody, old folks, 80 years old in the family, have cancer, and then it comes to a situation where you need to make a decision. Do you do or you don't do for the treatment, 80 years old? Will you do or not? You will. You will proceed. So even though it is like throwing money down the drain.
That's why I always ask, what is your ATM card number?
What's your ATM card number? Wow. Actually, that's quite practical to so that extent. Yeah, I know what you mean. Okay. So at the end of the day, always remember, even when we do that, 80 years old may not, how should I put it? Always remember, after you spend the money, 80 years old may not be able to tolerate the entire standard procedure and they will pass on halfway through. However, does it mean that everybody cannot? Not necessarily, because some can, some cannot. It depends on individual. A lot of times, the doctor will do their recommendation, but always the family members are the ones who sign for it. Understand, yeah? Okay? Good. This is general knowledge that we must know in order for you to understand why we want to take back control on our own health. Okay? Next one. Basically, for a lung cancer situation, during the diagnosis alone, it costs 10,000 to 13,000. Then after that, pre-diagnosis will cost about 645 per month. However, if you are confirmed and then go for standard clinical, it will cost about 10,000 to 13,000 dollars just for lung cancer. Okay, just for lung cancer per month. These are per month. Next one. Let's take a closer look with DBS. Anyone have searched for this before? DBS actually have a record of the amount of spending that we will need to pay when we have cancer situation. Alright? Yeah, you don't know. I see the face of it. Oh, you don't know. Yeah. We are living in Singapore. You can die, you cannot fall sick, like over here. Oh, you know. Oh, yeah, can die, cannot fall sick. Okay, now let me explain. So for chemotherapy, take a closer look, zoom in. Chemotherapy, even standard on the left hand side public hospital and standard ward range between daily surgery $51 all the way to $2,000 if you're hospitalized. Right? On the extreme right is actually private hospital and clinic. It ranges between $3,000 plus $5,000. Clear? Day surgery is day surgery, correct? See, okay? Now, the next one is lung scope. Lung scope with biopsy and surgery to remove the tissue. On the left hand side, on the government side, is $600 plus to $3,000 all the way up. On the extreme right private, you will see $3,000, almost $4,000 plus $20,000 in hospitalization. So total the cost will cover $5,000. Yeah. Okay. Next one. Lungs with abnormal growth, but not very severe complication. government side range between 1,002 to 1,003, and on the extreme where the private is, it is actually at 5,000 plus another $8,800. Can see the difference now? Can see, yeah? Okay, good. Next one, lungs with abnormal growth and very severe complications. You see, the price like macam buy menu, buy food like that. Got menu, no? This stage is this price, at this stage is this price. With complication, this is another price. Okay? So basically, the hospitalization rate between 2002 to 2006, and inpatient on the private side is actually $25,240. So if you do not have money in your bank, you better make sure you don't fall sick. Really make sure. Okay? Next one, colon cancer. Colon cancer treatment in Singapore, how much does it cost? Colorectal. This is directly linked to what we have, what we are eating. Okay? Basically, take a closer look. Colonoscopy for diagnosis with or without biopsy. Basically, on the left hand side, under the government, 500 plus, 1,700 for the hospitalization. And then on the private side, you will see 2,500 add on another $6,000, close to 10,000. Next, surgery to remove part of the enlarged intestine. Basically, government is actually 4,000 to 5,000. Private is 37,000. Okay, 37,000. And surgery to remove part of the end of the large intestine and rectum. Basically, government is 4,000 to 5,000. Private is $47,321. Okay. Next one, surgery to remove cancerous growth in breast and underarm lymph nodes. Government is 2,000. Private is 23,000. It's 23,000. So for women, please take care of your emotion, take care of everything as well. Breast cancer is one of the top 5. Careful. Right. Next one. Day surgery to remove single growth in breast is about $1,000. Private is close to 7 plus 9. It's about 16,000. Right. 16,000 for private. Next one. Surgery to remove entire prostate and surroundings is for men. Basically, government side is about $10,500, and for private is 53,000. So men, please take care. Okay, prostate cancer is the top 5 among men. All right, don't play. Next one. Basically, surgery to remove entire prostate and surrounding. Government is actually 10,001 to 10,005. For private is 53,000. And endoscopy with or without biopsy. Government side is 300 plus 1,005. Private is about 2,000 plus 7,000, so coming to 10,000 as well. And then for stomach, liver, or pancreas cancer, but not very severe complication, not severe yet, you still need to pay under the government side approximately 800 plus about $2,000 on hospitalization, and the private side is about $8,500. Now, after you have seen all this, how many of you feel that to be sick is actually very expensive? Can I have a show of hands? To be sick is actually very expensive. Yeah. Once you understand that, it is important. Okay. Just see. A lot of times, people say I am healthy, but how do you know? Most of the time, when we diagnose got cancer, got this, got that, the critical condition already reached stage 3 and stage 4. Usually, that's the case. And a lot of time, there's nothing we can do, but just to like 死马当活马医 means in English how to say 死马当活马医. In English, it means the horse already going to mati. You just treat it as a live horse, try to feed it. It's a direct translation, right? That means it's going to go young, going to rosa anyway. You just might as well sudah whack only and try. Right? You don't try it. All right. So once you understand, being sick in Singapore is very, very expensive. I do not know about other countries, but Singapore is very expensive. All right. So after knowing all these costs for being sick, the next question you could ask yourself: would you want to be sick, painful, and broke? Yes or no? No? Those who say no, raise your hand. I don't want to be sick, yeah? Okay, good. And or would you want to be healthy, young, and energetic most of the time? Yeah, we all want to do so. If the blue color one, young, healthy, and energetic is what we want, that is starts immediately. It's not going to say when you get sick, then you want to start. Too late already. Your wear and tear already rose up, already gone case, then we decided to do something. It's too late, understand? We have to start now immediately to maintain it. Right? So how do you go about doing it? Let's talk about colorectal cancer. Most of the time, cancer doesn't just come like that. It started, especially colon. This is our rubbish dump in the stomach, our mouth. This is our toilet bowl. When it started at stage 0, that's because there are something a pimple in our colon. Okay? This is what we call a pimple. I call it easy. It's actually a cyst. Alright. From there, you go to stage 1, POPs. It's actually called POPs, stage 1. And then stage 2, it will grow to tumor. And then stage 3, it will become bigger. Stage 4, it becomes so big where they have to cut now. And then it will spread to other organs, especially here in the stomach. Now, why I say that, take a closer look. See, if this is the place where your colon cancer is, you have a big problem because it's very difficult to cut here. But if let's say usually when it comes, it doesn't come out right. If it's here, you still can spend about 53,000 and then cut here. Okay, no problem. But if over here, then you prepare to take out the entire thing and then put back again. Because this is where this is coming out from the rectum. This one is not. This is linking to the other intestine. You understand? From the smaller to the big one. Clear, yeah? So you cut here, then what happens to the smaller one? So it's very complicated. Very, very complicated. Never allow yourself to go into a situation like this. Now, why do we do that? Why our body is able to have that kind of situation? Okay, I am going to use a drawing. Can I use drawing? I brought come. Now, bear in mind, every time when we eat something, do we choose what we love to eat or what our body needs to eat? Love to eat, right? So we always choose what we love to eat. So example, yeah, broccoli and fried chicken. Which one healthier? I said, which one healthier? Fried chicken. You see, subconsciously already come out already, okay? So we all know, between broccoli and fried chicken, which one healthier? Broccoli. Between water and soft drinks, which one healthier? Water. But soft drink, less healthy, but people prefer to go for them. Between coffee and water, which one healthier? Water. So we always know which one is healthier, but we somehow always choose what we enjoy. Okay, so if that is the case, now can you imagine if we were to always choose what we love to eat? Can we guarantee what goes in the body doesn't want? Those that body doesn't want, will it be able to come out 100%? Cannot. If it cannot come out, here comes the situation. If it cannot come out 100%, then it will stay in places. I'm going to show you just now why there is pimple in the colon. Okay, basically when it doesn't come out, you have a situation because it will stay in places like this. When it starts to stay in our colon, it will be accumulating. When it's accumulating, this is where your problems start. Why? Because in the whole colon, this is actually our toilet bowl. And this one has no muscle and no bone. There is nothing supporting this entire soft thing. Okay? This entire colon. Now, when it becomes heavy and there's not enough water, it becomes heavy, it will press down. Once it presses down, for men, you just bulge out the stomach, like that. But for women, it will hit two areas. That's the reason why when it presses down, you see some women, small waist but have snoopy tummy. Why? Because the ovary and the womb is. So when it presses down. So if let's say they don't clean up this entire colon, sooner or later, most women will kena colorectal, ovary, the womb. All will kena 3. So women have a higher chance of getting all 3 types of cancer simultaneously, one after another. Do you understand? Huh? So it's better to start cleaning this. Just imagine this. Just imagine this. When you go to the toilet at home, after you do your big business, do you flush? Yes? Yes? Flush? You flush? Okay? Now, how many people in your family using toilet? 3. Imagine all 3 of you use the toilet but don't flush. Cannot. Cannot. Don't flush for 3 days. Pingsan already, right? The smell. Imagine don't flush for 50 years. It was right, okay? Now, this is a very logical thing, but most people are very natural not to go toilet. I give you an example. During baby times, one in and then one out, correct? Baby feed every 2 hours and every 2 hours it comes out. But when we grow older, how many meals you eat? Siti? 3 meals, 3 times a day. How many times you come out? 1 time. So the balance 2 times go where? Stay here, correct? So 2 per day, balance here, times 365 days, times 40 years. Of course your stomach become bigger. Understand what I'm trying to say? Clear? So this is very, but the logic is always there. What go in must come out. If it doesn't come out, I tell you, it become very heavy. Like for example, cash, right? Araja, How many kilo you dropped already so far?
5 days again.
5 days, 5 kilo, right? And then what's more significant is you don't eat for 5 days, you still have full of, sorry, I'm going to say, you still full of shit coming out. Let's give the man a round of applause. Awesome. Okay, that means we really eat too much. We really eat too much already. Please don't stuff yourself like a pig. Don't do that. Okay, we don't need to eat so much. Already proven. You don't need to eat for 5 days and you're still full of shit coming out in a sense. Alright? Now, this is right in the center of the body. Right in the center. Everything is linked with blood vessel. Now here comes up. So it links to places like your heart. This is not exact location, just for illustration purposes. And then it links to places like our lungs. And then places like our kidney. And places like our liver. Now, with the toxic accumulated, it will start to come out from the blood vessels. Because it's all linked, just like a PiP system. Just like our sewage system. Same idea. So when all these toxics start to leak out from here, will it affect the department? It will affect the department. When it affects the department, example, liver, that is where you will see slowly you have skin problem. Because every time when you see someone have skin problem, usually it's because liver and blood have issue already. Clear, yeah? So always remember, do not kid yourself, try to be very honest with yourself. Check your diet, clean up, alright? So what we do, if this is the case, the first thing we must do is take a lot of dietary fiber. Now, how many of you take fruits and vegetables every day? You do, okay? 10 bowls a day? 10 bowls of fruits and vegetables, but that's exactly what's required, 35 grams, 28 to 35 grams of fiber. If you're not taking enough of that 10 bowls, it won't be enough to clean up in that sense, alright? So, this is not by me. Later I'll show you, it's recommended by the American Heart Association. So a lot of the times, we are not eating enough. So how? You stuff yourself, man? No. So we need to find a way to have dietary fiber where it is concentrated, giving you the 35 grams that you need to flush the whole system out. Okay? And the fiber that we have is very good because the minute when you put it there, you shake, you must drink. If you leave it there for about 5 seconds, start to become jello, right? That jello formation must be inside so that it is able to coat all these out. And then when you drink water, they absorb already. It's like a sponge, they absorb all the toxin already. And then when you drink water to flush, the first flush is the most difficult. The second flush, if you are able to flush it out, oh my god, you become very light, correct? That's why he's smiling all the way, right? Every day. Well, now, let's give the man a round of applause. Awesome. Okay, good. Now, understanding this today, I'm going to zoom in specific more on colon cancer and how to prevent it and how to keep it clean. Alright? Alright? So this is the case. Remember, do not even allow it to grow or stay in your colon when it is stage 0. Stage 0, people also do us. Alright? So signs of colorectal cancer. What? Men and women, top 5. This one. Okay, first thing, sudden changes in bowel habits. Okay, example, diarrhea, constipation, loose stool. So if you are going to the toilet only once a day, beware. If you are going 2 days once, lucky more, beware. 3 days, then go 1 time, you have to take care. Alright, I see some people 2 weeks 1 time or 1 month 1 time. I actually hear before, so that's very bad. Alright, okay, next one, crimson blood stains on the stool. That means you have blood coming out from the stool. Okay, that means there are stains on the blood of the stool. There are blood stains. Okay, next one, lump or pain around the anus. That means where your ass is. Clear, yeah? Okay. yeah, of course. Okay, sometimes we have to be very direct to talk about it. At least you understand. Right? Next one, constant gas or bloating in the large intestine or rectum. Constantly bloating when you feel. Or unexplained weight loss or loss of appetite suddenly. Okay, that means usually you have this kind of symptom, meaning it's stage 3 or stage 4 already. A lot of times. If you are lucky, stage 2 or lucky, you usually can find a way to reverse it. And unexplained anemia, abdominal pain with or without swelling. Okay? Next one, dietary fiber. Now, this is important. You need to know how to have it. What is actually dietary fiber and how much is enough? Let's zoom in. The 5 main nutrients of life that we all must have actually. First, protein. Second, fats. Next one, minerals, and then vitamins. So 18% protein, 15% fats, minerals is 4%, vitamins is 1%. How many of you have this myth or this belief that you want to keep your weight clean, you want to make sure you don't put on weight, you eat less fat? Yes? Correct? You have this idea, right? How many of you think that way? You eat less fat, you don't get fat. Yes? But what if I tell you, you get fat not because you eat fat. You get fat because you eat too much of rice, noodles, roti, prata. Okay? You get fat because you eat too much of carbohydrates and you are not using that energy. Okay, let me explain to you. Long time ago, our father, our mother, our grandmother always tell us, must makan rice. Nasi, you eat rice, you have more energy, correct? Why? Because in those days, they need to go down to the farm and then chanko the whole day. They need to use a lot of energy, okay? Or they are like coolie, they have to carry heavy stuff or doing shifting. Today, how many of you actually carry heavy stuff? The only heavy work you do is your finger, or like that on your thumb, that's it. No. Why you take so much of carbo for? Understand what I'm trying to say? Clear? So when you take too much of carbo and never use, it stores in the body. It will spike your insulin. Once you spike insulin, the next problem will develop called diabetic. Understand? Clear? That's why you feel very tired. That's why I say try to reduce. If you are not working out very much, don't need to take so much carbo. Alright? Next one. Okay, adults need at least 25 to 35 grams of dietary fiber a day to help to clean up. It's okay to eat whatever we want, but we must find a way to clean up from the body. Flush your toilet, understand? Don't keep it there. Next one, vegetables, okay? How do you go about doing it? For children, 3 servings, fruits, 2 servings for vegetables, okay? Vegetables on the left hand side, fruits on the right side. For adults, you need to have 4 servings of vegetables and 3 servings of fruits. That means 7 servings every day, yeah? Elderly, 5 servings plus 4 servings. Total how many? 9 servings. So it's approximately 10 bowls. Approximately 10 bowls, correct? Okay. It is almost impossible for modern people to eat enough dietary fiber in their eating habits. Why? Take a closer look. First one, pursuit of happiness. Delicacy, focusing on taste. Heavy dosage, right? How many of you go to buffet? And you go to buffet makan before, right? So when you go to buffet, will you eat vegetables? You pay $35 to eat all you want. Will you buy? Will you take vegetables? You won't. And then you go to those steamboat, eat all you want steamboat buffet, right? Most of the time, what do you take? All the meat, all the lobster, whatever. Nobody take vegetables, right? It's like they only eat cow, the $35 must eat back. Yeah, clear? Hey. I also don't know what to say, alamak, okay? Feasting on seafood and meat without any greens. It's like greens is like wasting money for them. Okay? So next one, fast food culture, the refined processed food. Things like McDonald's, KFC, and then potato chips. Now, do I eat potato chips? I love potato chips. Me. I love it. So, do I take every day? I used to take 2 packets a day. Long time ago. Yeah, correct. And then, when you come of age, around 30 plus, and finally look at yourself, something is very wrong. You have to look in the mirror, then you know. For men especially, okay? If you are at a stage where you go to the toilet, you want to pee, you look down, you cannot see anything. If you cannot see, you cannot aim, something is very wrong, correct? Because your stomach already blocked everything. For women have problem now. Actually, don't have because you just squat down. You just sit on it, right? Correct? But don't be fool. Please make sure because you have womb and ovary there. Okay? Next one. White rice, not brown rice is very bad actually. If you want to take brown rice, it's a lot easier. Okay? Next one. Eat only peel fruits. There's a reason why they don't have enough fiber. Some of the fruits, okay. Why people peel the fruits? Why? Do you know why? Because when we were younger days, your parents or our parents don't know how to clean and remove the pesticide properly. So when we eat the fruits, there's a bitter taste, correct? That's why they have to peel away the skin. But the skin is where all the fiber is. Correct? So if you can find a way to clean all the pesticide out, if you touch the fruits, still have waxy feeling, means the pesticide is still there. Yesterday, I bought 2 boxes of cherry. I was so happy. Oh, I want to enjoy. I take out the cherry, white color. I go to the toilet, I do. I say, wow, still have that. Still have. Then I take hot water a little bit. Then they come out so. Then they come out. Clear? So please take the time to look at what you are eating. Don't just voila, and then see white color. If you have grapes, it's white in color. Those are pesticide. Okay, those are pesticide. Remember, yeah? Okay, good. Next one. Drink only juices. Okay? You need to drink only juice with the fiber. You blend it, you don't squeeze only the juice out. Clear, yeah? Next one, choose only tender green shoots for vegetables. See, our mouth will become very delicate. We want soft, we want this, we want that. At the end of all the mouth got cancer. Okay, next one. Third, eating out 3 meals a day, fast, convenient, and delicious. Alright? Is there a lot of MSG outside actually?
Yes.
Or Ajinomoto? Yes. Okay, for those who have done the reboot, listen carefully. If you have done the reboot, your body is more or less kickstart into a cleaning system, cleaning cycle. If you were to take certain food outside and then you eat, after that you feel that like a little bit numb, the tongue like numb, got some funny feeling there. It means that dish that you order have a lot of MSG or Ajinomoto. Understand? Your body can tell you a lot of stuff once you clean it up. If you feel nothing, means your alarm system working or not working? Not working. Do you know why not working or not? Every time got sign and symptom, you just take when the fire alarm ring. You know what you do? You get up, you take the boom, and then you whack the thing. Shut up! Don't ring anymore. It's the same idea. You go to 7-Eleven to buy Panadol to tamba the thing, and then cool off, no more already. You're not allowing it to show. Clear, yeah? Okay, don't do that. Please take care of yourself. Alright? Next one, number 4, culture of treating meals. Culture of treating meals. Big piece of meat and seafood, only 1 out of 10 dishes is vegetable now. What do you mean by that culture of treating meals? Example, when you invite your friends, ask you, I invite all of you to come to my house for a kenduri, for a makan, for a feast, happening feast of Christmas party, okay? Should I give you all fruits and vegetable only? Then you say, oh, Marcus very meow. Correct, wow, like that. No. But the truth is, when you give all your friends chicken, duck, fish, whatever, all the meat, and then the vegetables only 1 or 2. Understand the logic? At least there must be a balance. Yeah. So the culture of throwing a party, inviting people, eat all vegetables, people, and say that you're very meow. So we cannot do that. Logical, yeah. So understanding all this already, does it mean that we should stop all this? No, we should balance it out. Understand? Balance out. Put something in. If you know it's not so good, please take fiber, take fruits and vegetables, take whatever it is and take it out. Take 1 day meat, rest 3-4 days. Can you? Understand what I'm trying to say? Yeah, clear. Okay, good. So next, based on American Heart Association, according to the AHA, most people only consume 10 to 15 grams of fiber or less, as opposed to the original 25 to 35 grams needed. Alright? Why? Let's zoom in. A typical meal prepared like this is already very healthy meal. But on average, you take a closer look, it's only 7 grams to 8 grams allowed. All greens. Only 8 grams. Okay? This one salad, 8 grams only. You put the broccoli and with the egg and all that, right? Fiber is only 9 grams. You put almond, this one 22 grams, but this is a salmon with beans and veggie, 22 grams. This one 7 grams. This one only 7 grams with eggs, egg and veggie scramble. Avocado toast with this one is only 9 grams. So whatever you think you are eating, it is not enough. Not enough at all. Okay? Not enough at all. Next one, and the best part is, can I ask, when you have Malay food store, do you have this? How many of you actually go and calculate how many grams of fiber is there? Because I remember go to the Malay food store, you see rendang. After the rendang, they tambah what? What they tambah inside there? Rendang and rice. And then a lot of gravy and then tambah 1 egg or one, I don't know, only 1 vegetables? Only 1 vegetables? Very 1 vegetable. And then some don't even take vegetables. They put the tofu, the chili, and then sambal goreng.
Yeah, the tofu, the chili, the tempeh.
Tempeh.
Those
Must go with the one. Then where's the green? Where's the green? The one only one. That one, how often do you eat that one? Not many. Yeah, that's my kids. I give her a round of applause. That's my kids. Okay. So once you understand this, let's zoom in. Basically, our daily diet needs to eat at least 10 bowls of vegetables like a rabbit, okay, such as celery, carrots, cabbage, whole grain, fruits, nuts, beans. These are what is needed. If we are not able to eat like this, then we better find another alternative. Understand? Clear? So, lack of dietary fiber, what will happen? First, you will see constipation, obstructed movements, and black bowels. Alright? Next one. Number 2, POPs. Basically, these are pimples in your stomach. The first stage of tumor formation which eventually becomes colorectal cancer. Alright, take note of this. Next one, number 3, diverticulosis. Basically, it's pops sink into the intestinal wall where your colon is to form a hole so that all the accumulated feces and all the bowel that cannot come out, right, will go into this area and then stuck again. Like our pimple pore, you understand? When it becomes very dirty, stuck inside there and then it goes backwards, linked to outside, linked to other organs and departments. Like what I showed you just now on the blood vessel. Okay? So, and then it will link into flow back into your abdomen. So when it starts to flow back into your abdomen, for women, it's very dangerous because of the womb and the cervix is there. Alright? Next one. Diabetics, okay? Diabetes, hypertension, and high cholesterol. If your toilet bowl never clean up, never flush every day, your colon never clean up, diabetic fiber absorbs bowel acid and excrete improperly and promotes cholesterol metabolism into bowel acid. This will lower cholesterol, reduce high blood pressure and heart disease at the same time. So going on the reboot actually helps your body to re-kickstart a system that it can do balancing. On the 24th hour, after you do a reboot and then you fast, your stem cell system is re-kickstart. And then after the 24th, on the 48th, if I'm not wrong, your growth hormone will kickstart again. Yeah, so the whole system actually reboot itself. And losing weight is actually a byproduct, it's not to lose weight. And surprisingly, you tell people go lose weight 1 month, 2 kilo. But you tell them not to be healthy and do a reboot, right? 5 day 5 kilo, 5 day 8 kilo, normal. Understand the concept? Focus on being healthy, losing weight becomes natural. If you focus on losing weight and then try to get healthy, you will never reach. Everybody will have the same problem. Clear, yeah? Okay, good. Next one. So appendicitis, gallstones, ischemic heart disease, these are all the symptoms that will come if you never clean up your colon. Alright? Next one. Basically, the main functions of dietary fiber, what does it do? First of all, it helps large intestine movement. It moves your shit out and clean up. Okay? Next one, lubricates large intestine and smoothen the stool. Okay? Next one, increase manure volume and shorten the time of stool staying in the large intestine. We want to clean it up as fast as possible. Don't stay there. Alright? Next one, cultivate the benign bacteria to keep the pH of the large intestine stable. That's why when you take fiber, if you are able to add yellow lemon inside, you shake it and you drink, it tastes better for some people. And what is more important, after 30 days of mixing with the yellow lemon, with the fiber, your skin becomes very different. It becomes red. Reddish, rosy. The word is called rosy in English. Okay? It's actually rosy from inside. Actually. Okay. Next one. So because we try to eat, we try to enjoy eating. This is what we do. It's like you work very hard, you enjoy eating, right? This is what it's happening. But you must understand, if your input is larger than your output, or your input is faster than your output, you have a huge problem because toxins are all put in our large intestine. It is possible that colorectal cancer will find you because you are not putting out fast enough. Clear? You are not putting out fast enough. The minute you see tummy coming out, means you are not coming out fast enough. Alright? Okay, next one. So we clean the toilet every day. Not to mention our intestinal hygiene. It must be maintained. So let's clean after each meal. Okay, clean after each meal. Don't just take 3 meals and then come out 1 time and then keep 2 times. Don't do that. If you can, always strive. Aim. Go in 1 time, come out 1 time. Go in 1 time, come out 1 time. Then you will find people have this habit. Wow, jialat, eat 1 time, come out 1 time. Yeah, that's why 1 hour lunch break. Yeah, you eat 1 hour, man, you go what? How many of you sit down there for 1 hour, the cold dish, your food from hot become cold already? Nobody actually eat 1 hour, actually. Correct? Right? You eat already, you grab 1 hour, and then the rest of the 45 minutes, what do you do? It's for you to go and shit and clean up for the previous one. Clear, yeah? Okay, good. And the next one, you take breakfast in the morning, correct? For some of you. If you take heavy breakfast, you realize that you will fall sleepy before 10. And then 10 o'clock, you must have tea break, correct? You must have coffee. Correct? So most of the time, people may not have the chance to take breakfast nowadays. I tell you, breakfast, it means breakfast. From 4 a.m. to 12 p.m. is actually where the body is removing all the rubbish from here. It's detoxification time. You take a lot of water, a lot of fruit juices, it will help the thing to flush out. I give you an example. If you wash your toilet, after you chuchi, you wash until very clean already, what do? You take a pail of water and you flush it out, right? So would it be clean? It will be clean. Now, can you imagine it? You flush kopi or kosong? Can Or you flush roti prata? Oh, huh? Flush what? Okay, so the logic is always there. We just need to understand the logic and then flush it. The first glass of water, go in, don't take kopi or take clean water, 1 glass, and then let it flush out. Clear, yeah? Okay, good. Next one. Basically, welcome. Okay, FiberGo, this is what we have launched just 2 weeks ago. Alright, 2 weeks ago. This is actually a soft launch. It's not even an official launch yet, but we already sold out. Let's give ourselves a round of applause. Okay, the next batch is coming in next week, so if you all want better, order fast. If you want to more, very fast. Because it's very, very, very effective. Okay? And it combines 13 different fruits and vegetables, fiber together. It's very complete. And what is more important, one particular one, the 13 ingredients, one of the ingredients is called spirulina extract. Can you see this? Alright, this is the one when it stays in the colon for 8 to 9 hours, where the colon wall is. Our colon cell renew every 10 to 14 days. While it is cleaning, it allows the colon cell to absorb the ingredient so that they can do repair work and renew. Understand? Clear, yeah? That's the main reason why I use this formula for more than 17 years already. Okay? Good. Next one. These are all the certification across 3 different countries, certified in Singapore, Malaysia, and Vietnam. Alright? So halal, I think is done. ALS for heavy metal, no genetic modification. This one also, what I did was for my son when he is having constipation around 1 year old or 1.5 years for children, like even for 9 months can. You don't let them take the whole packet. What we do is, for my son at 1.5 years old, every time when I shake for me to drink in a cup, I give him 2 teaspoons. Understand? Just 2 teaspoons only, and then you see it moves very fast. It moves very smoothly for children. Right? Don't give them the whole pack and then they shake until they don't know business. No. Okay, just 2 teaspoons enough. Yeah, 2 teaspoons enough. Alright? Small spoon. Alright? 100% natural is a healthier choice than full vegetarian. Everything is all plant-based. Okay, natural. Next one. These are the certification and the halal certification that show you. Here from Singapore, GMO-free, under ALS, heavy metal safe, Dietary in Singapore, halal certification. Okay? So the factory side is GMP, everything all done. So we are very, very prime and proper when it comes to making sure that, because health products is something that we want to make sure we are able to help the human body, our children, our family, all are consuming it. So we ourselves have to be very clear. So don't have to worry. Everything is all done in Singapore. Okay. So the benefits of consuming 25 grams or more of fiber daily are, first one, significant hunger control. So because of this, for the past 17 years, we have many women, especially women, I don't know why. Women like to go for high tea, remember the last time? You see all the Thai, go time, hey, go high tea here, buffet here, 25 hours only they eat, as if they never eat before. Every week they go high tea, why no? And the best part is, I realized that some of them, when they go high tea, they actually have fiber inside their, the fiber go inside their bag. I said, you carry fiber go for what? You just need to, at night before you sleep, you just take around 9, 10 o'clock, then you go and go next morning. They said, no, do you know that if you're going for high tea, if you're going for buffet, you should eat a lot, right? And you will not eat so much of fruits and vegetables. You know what they did? They take, shake, drink, coat tape first, go inside buffet, whack, and then go back out, come out. Understand? So the whatever rubbish they pump in, never even stick into the stomach and never even go into the body. Not even absorb, straight away, keluar, straight away. Now I know. Now you all know the secret. No wonder how to maintain slim. Eat all you want, but you never get fat. Is this a dream?
Yeah.
Is this a dream? Is this a dream? If not, if you this one, I increase 1 kilo. I tell you, if you can increase over a weekend on a cruise 2-3 kilo, you can definitely lose that 2-3 kilo also. Understand? It is very logical. If you can put it so fast, you can obviously put it off and lose it so fast also. You just need to give you a chance, your body to take it. Understand? To take and remove and start cooking. Alright? So take fiber before you want to go for buffet. Clear? Next one, say heart disease protection, and then severe relieving constipation, stop occasional bloating, reduce water retention. Alright? Next one, it actually helps to break up fiscal matter, support colon health, promote slimmer body shape. Of course, the slimmer body shape giving you a smaller pair. If you want to show big, small waistline, no. If you want that shape, then you have to exercise. You cannot be taking fiber and then automatic the shape will come out. Don't have that. If like that, only to go fitness, no need to go gym already, correct? Okay. So adds yellow lemon juice to enhance skin condition to have a healthy pinkish radiant glow. That's what I'm talking about. Reduces cholesterol and blood sugar level. Next one you will see is lower risk of cardiovascular disease such as stroke, prevent diabetic, increase digestive and bowel health, fuels healthy gut bacteria. Very important. Your gut bacteria is very important. Okay. Now, how do you own it? Very simple. For 50 BB, you buy 4 boxes. Okay, original price is $146. The promo price is $115. So you save about $25. That comes out to about 18% discount, approximately about $28 per box. Alright. Next one, you buy 8 boxes, we give you 1 box free. Then 315 Sing dollar original market price. So promo price you get $230, which is you save $85, up to 27% discount. 1 box is only about $25. It's very affordable for everybody to be accepted. Okay, for the youth, you may want to think this is going to be a fast moving for you because I think the youth also have issue of constipation, right? But it just don't dare to shave, don't dare to say it very shy. So this can be a very fast moving methodology for you to go out to build distribution channel. Yeah, again using online because I teach you all how to do digital marketing so at the same time, right? So the last one is a little bigger for people who are interested in promoting and building a distribution channel. So you buy 2 or 3 boxes yourself to use. The rest sample. Sampling up. Clear? Because 1 box at 15 sachet, you give up to 3 sachet per sample. So 1 box you can actually target at 5 prospects. Clear? Within 3 days, straight away come back again. Within 9 hours, the effect comes. Okay? So basically 34 plus 4, market price is $980, promo is $690. You will save $296 up to 30% discount. So basically it's $24.64 per box. So retail is at $30 or $35 to be exact. Retail is at $35, right? Yeah, so that's where you learn the difference on the retail profit. Clear, yeah? Okay, with this, I wish every one of you, if you want to be healthy, young and energetic, basically very simple. Contact our partners from Singapore, Hong Kong, Taiwan, China, South Korea, Japan, Cambodia, Vietnam, Germany, and Italy for more information on Facebook. But if you are here live, talk to the person who invited you, who brought you here. Alright? Find out more how to go about doing it. If with COVID-19, health becomes a very important thing. With COVID-19, weight become an issue because everybody stay home and they eat and order, eat. Alright? And able to distribute an online business for you to have product all delivery all done for you, everything all done for you. Just to focus online, how to do and what to do only. Learn and pick up the skill, how to do that online. Alright? So is there any questions? Anyone? Don't have? With this, thank you very much for coming in here on Saturday on a rainy day. Okay, God bless and wish you guys a healthy, prosperous. Okay? See you.